Hi everyone, my name is John, the marketing specialist for Product Medical. This is my partner Chen Kang, the senior imaging clinic specialist. Today we're honored here to give you a digital subtraction angiography stimulation for the PLX7100. So as you can see, we have a dummy plastic attached with some plastic tube on the table, which will be demonstrate how the angiography works later. And as you can see, I'm not wearing a lead apron, which means I'm going to operate in the observation room by using two expansion monitors. Also, we have a DSC injector. The syringe is filled with contrast media and will be automatically goes into the plastic tube to show how the subtraction is done. Of course, we also have a table control tablet. It's shared with the same interface as the touchscreen panel on the CI. So you can see you can have radiography or fluoroscopy. But the most important, it has DSC options. That means the doctor can proceed a DSC operation right beside at the table. So that's all about the CI. If you're ready, I'm ready. Let's head to the observation room for further operation. Alright, ladies and gentlemen, we're at the observation room. You can see we have two expansion monitors right here, which we can operate the CR right to the workstation. And also we have a foot switch for the exposure controlling. So as you can see, this is the interface for the CR workstation. You can have your patient file management right here, or for the image capture or image editing. So let's create a new file for first. Now the first thing we can do is to take a fluoroscopic image. So we can press the yellow paddle of the foot switch. Now the fluoroscopic image is done. Next, choose DSC option, and then press the blue paddle of the foot switch. So the contrast media goes in, and the bone disappeared, leaving only the blood vessel behind. And that's for all the DSA simulation. So that's about the DSA feature for this CR. But before the end of the demonstration, I'd like to show you some of the clinical images taken by the CR and explain to you what kind of CR can apply to. So as you've been told before, the 71,000 has a maximum output power of 25 kilowatts, which means it can be capable for participating in most of the peripheral vascular interventional radiology. So what you see right now, the subtraction image of the iliac tract artery. You can see the contrast agent go through the internal and external iliac artery from the right common iliac artery. During this subtraction, the ilium and sacrum disappeared, leaving only the blood vessel behind. And this is an image of a renal arteriogram of a left kidney. In this angiography, an incision is often made at the iliac artery or the femoral artery, then use the catheter to advance through the aorta and arrive at the renal artery. Contrast media are injected into the artery to confirm whether there's a stenosis around here. For example, if a renal artery aneurysm is diagnosed, a PTA, percutaneous transcatheter angioplasty, may be performed. During this procedure, radiologists may use inflatable balloon to expand the narrow part of the artery, then implant a mesh stent to create a passageway in the artery, making sure the kidney to get enough blood supply. Now this is an angiogram of the liver. One of the established interventional procedure for cancer treatment is transcatheter embolization. Take this image for example. In this case, the patient was diagnosed with stage 2 hepatocellular carcinoma or liver cancer. The tumors are resectable due to metastasis. Therefore, a minimally invasive embolization therapy called TACE, transartery chemoembolization, can be performed. Now, because the hepatic artery is the primary blood supply for liver tumors, the goal of the procedure is to deliver chemotherapeutic drugs or embolization material to selectively cut down the blood supply for the tumors, so that the growth of the tumor can be slowed down and eventually be killed. In this case, the patient will inject with libido mixed with doxorubicin, which are common embolization materials for cancer treatment. Now, in some cases, the chemotherapeutic drugs can be replaced by radioactive microspheres like yttrium-90 microspheres to selectively radiate the tumors and leaving healthy tissue relatively unaffected. Such procedure is called SIRT, selective internal radiologic therapy. The PLX7100 is also capable for performing non-vascular interventional procedures. The most common and frequent application so far is the image guidance in gastroenterology surgeries. So as you can see, this is a URCP procedure with gallstone extraction. It combines gastrointestinal endoscopy, as this one, and with X-ray to treat problems of bile and pancreatic ducts. In order to extract the stones out, the endoscope is first in through the mouth, advancing through the esophagus, and then deliver at the duodenum. Then sending a balloon to expand the major papilla via catheter. The stone basket is later entered the common bile duct through the papilla to extract the stones out. Please notice the contrast agent is injected to confirm the obstructed bile duct is cleared. Now the image is just received from Branch Hospital of Nanjing Wulao Hospital. It is one of the largest comprehensive hospitals in Nanjing, which is also a long-term business partner with our company. Take this gastroenterology department, for example. It is recorded that an average of 200 cases of ERCP procedure can be performed every month. Now, other non-vascular interventional procedures, including PCNL, percutaneous nephrolectomy for removing kidney stones, or neurolysis for the treatment of neuropathy, can also be available as a surgical option. Now, in addition to the clinical use mentioned above, the 71,000 has available to participate in the orthopedic surgeries. For example, when it comes to the treatment of spinal deformities, scoliosis, or degenerative disc disease, the 71 can be used for bone imaging and precisely targeting the implant position. You can see we have a pedicle screw emplacement at L4 and L5, both at lateral view and AP view. This is a case of a vertebroplasty, and this is the process for the cement injecting. Alright, thanks for watching, and that concludes our demonstration of the CF7100. If you have any questions, please feel free to consult with our sales team. Goodbye.